Hello everyone. Before I get started, I'd first like to recognize the Gomeroi people, the traditional custodians of the land in which this poster was created. I'd also like to pay my respects to elders past, present, and emerging, and recognize their enduring commitment to a cultural and community-based health outcome. My name is Zade Thahir, and I am currently a final year Bachelor of Oral Health student at the University of Sydney. And I would like to bring your attention to a summary of my poster titled Healthy Smiles on Gomeroi Country, Addressing Barriers and Promoting Access to Healthcare. And this is currently linked to our Oral Health and Society subject, where it allows us to fuse evidence-based practice research into better community health outcomes for deprived communities and cultures, such as the Aboriginal and Torres Strait Islander people. Now, there's no doubt that Aboriginal and Torres Strait Islander people are actually experiencing much more disadvantaged outcomes when it comes to their oral health. And over the past years, including the year 2023, the Australian Institute of Health and Welfare actually found that 90% of adults and only 58% of Indigenous children actually visited the dentist in the previous year. The Gomeroi people or the country is now recognised as the Tamworth region or part of the Tamworth region with a mean age of 21 in relation to the 2021 census data. And it's important to recognise that these issues have been limited but drawn to a broader kind of issue in the past years. So when we start off in 1963, I would like to bring your attention to this graph formulated by the Health 2018 data, where it describes the decline in the mean decayed, missing, and dental and filled teeth among 12-year-olds following fluoridation in Tamworth and the region. And the introduction of fluoride into the area has dropped the mean average of DMFT from 8.7% down to 0.9% in 1988. Now, whilst this is a dramatic and drastic positive outcome for the people, it's important to understand that they are still experiencing other types of barriers such as transport, fee, and costs. And it's important that we are actually analysing these barriers and providing evidence-based recommendations, which is the objective of this poster, to go through evidence-based research to provide and identify the barriers and also provide evidence-based recommendations that enhance oral health care, access, prevention, and community involvement for the Gomeroi people. In regards to the methodology used, a systematic review was conducted through various systematic search programs, and the terms Aboriginal, Indigenous, and barriers and interventions and oral health or dental was utilised, and this process was summarised in Figure 2 to actually outline 8 research articles that specifically identify barriers and recommendations for the Gomeroi people in relation to their oral hygiene and oral care. Prominent research articles included Patel 2021, Gao 2021, and Lin 2023, where the main barriers included limited accessibility and transport to actually access these services, financial constraints to afford these services, low oral health literacy and education, shame and fear, and poor communication and cultural insecurity, furthered by ineffective clinician-patient communication and a lack of ability to build a rapport with these communities. Now, in terms of the recommendations, the key recommendation supported by Patel is the integration of dental care with primary and anti-dental health services, and this is shown in Figure 3, where an oral health student from the University of Melbourne is actually carrying out basic oral hygiene instructions to an Aboriginal child. And through this, another recommendation is to expand these mobile and outreach programs, integrate effective communication skills such as clinical yarning, and building trust to improve patient-clinician relationships. A Gao study in 2021 also supported the recommendation of engaging Aboriginal communities in service design and decision making to ensure cultural security and program sustainability. Not only we want to improve their oral health outcomes, we want to get them involved in the process, show them that we care, and shift towards a more preventative and community-based service model rather than a purely operative approach. In conclusion, that this analysis emphasises the obstacles to oral health that Aboriginal and Torres Strait Islander people, especially in the Gomeroi country, face on a daily. And research indicates that increased access through integrated mobile programs, community involvement and service design, and culturally safe communications are necessary for improving oral health outcomes. Thank you for listening, and feel free to scan the QR code for your references.